We'll look at another knee issue, and this is what is known as a patellar tendonitis. Some people call this the patellar tendonitis. Okay, and it's simply known as a jumper's knee. Okay, jumper's knee. So you just have to do with the inflammation of the tendon there. That's a patellar tendon. That's a tendon that you have the patellar bone being inside, holding it down, mostly the down one. Okay, so patellar tendonitis, also known as patellar tendinitis, is an overuse injury of the tendon that connects your kneecap, that's a patella, to your shinbone, that's a tibia. It's especially common in athletes that jump a lot. That's why they call that what the jumper's knee. Okay, so people that do basketball, people that play volleyball, you jumping, smashing, track and field events. It can also occur in anybody. So causes is repeated stress on the patellar tendon. So tiny tears over time is causing inflammation and is weakening the overall patellar tendon. Okay, so symptoms is there's a lot of pain around the kneecap. Stiffness and tenderness is developing, especially after you use that joint repeated again. Then the pain worsens when you try to use that joint for some activities like jumping again, running, or when you want to go up the stairs. That a lot of pressures will now be on the joint, so you have a lot of pain by then. So what are the risk factors? What are the things that you could be doing that will make you have this condition much more easier? So if you frequently jump on hard surfaces, and sometimes maybe you are preparing for a big match, so the training is now intense at that time. Then also tight quadriceps or hamstrings. So diagnosis is clinical examination where you're looking at all those signs and symptoms. Then you can also do imaging to now look at the internal environment, what is wrong. Okay, so tiny tears over time causes inflammation and pain and stiffness. So treatment and management is the activity that made you have this, you have to now reduce that activity. Do you understand? The eyes and NSAIDs reduce pain and inflammation. Then physical therapies where they can now stretch, do some 1 or 2 small exercise just to maintain mobility there. They can also brace, they can also tape. Then when you return back to your sports, you don't return to the crazy exercise, but you just integrate little by little.